Food Allergies Webinar, Miami-Dade County Public Schools Department of Food and Nutrition. Disclaimer: this PowerPoint provides general information about health and related subjects. The information and other content provided in this PowerPoint or in any linked materials are not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Overview: food allergy versus food intolerance. What is a food allergy? What are the most frequent food allergens? Symptoms of an allergic reaction. How to treat an allergic reaction. Procedure before teen. Head Start and Early Head Start programs. Our schools' kitchens. Smartphone apps. Let's review some concepts. Food allergy versus food intolerance. First of all, I would like to explain the difference between these two concepts. Can be confusing. A food allergy causes an immune system reaction. In some cases, an allergic food reaction can be severe or life-threatening. In contrast, food intolerance symptoms are generally less serious and often limited to digestive problems. What is a food allergy? A food allergy occurs when the body's immune system sees a certain food as harmful and reacts by causing symptoms. This is an allergic reaction. Foods that cause allergic reactions are called allergens. Mild and severe symptoms can lead to a serious allergic reaction called anaphylaxis. This reaction usually involves more than one part of the body and can worsen quickly. Anaphylaxis must be treated right away to provide the best chance for improvement and prevent serious, potentially life-threatening complications. What are the most frequent food allergens? There are 8 common food allergens: milk, egg, peanut, tree nut, which are almonds, walnut, pecans, cashews, and pistachios, wheat, soy, fish, and shellfish. Allergies to peanuts, tree nuts, fish, and shellfish tend to persist lifelong. Allergies to milk, egg, wheat, and soy often disappear with age, but not always. Milk and egg. According to kidswithfoodallergies.org, milk allergy is the most common allergy among children. 1 to 2% of U.S. children have a milk allergy. Children with a milk allergy must avoid milk in all forms. This includes all milk and dairy products, including lactose-free versions of milk products. Egg allergy is the second most common allergy in infants and young children. About 1.3% of children in the U.S. have an egg allergy. Peanut and tree nuts. According to kidswithfoodallergies.org, peanut allergy is a common allergy among children. Around 0.6% of American children have a peanut allergy. Is usually lifelong once acquired. Must avoid peanut in all forms. This includes all peanut products. Also must avoid anything containing traces of peanut ingredients in it. Tree nuts allergy. Around 0.4 to 0.5% of American children have a tree nut allergy. Soy and wheat. According to kidswithfoodallergies.org, around 0.4% of American children have a soy allergy. Children with a soy allergy must avoid soy in all forms. This includes all soy products and where soy is listed as an ingredient. Wheat allergy. Wheat is a grain that has been reported to trigger allergy symptoms. Children with a wheat allergy must avoid wheat in all forms. Fish and shellfish. Fish allergy. According to foodallergy.org, about 40% of people with fish allergy experience their first allergic reaction to fish as adults. Shellfish allergy. There are two groups of shellfish: crustaceans such as shrimp, crab, and lobster, and mollusks such as clams, mussels, oysters, scallops, and octopus. Shrimp being the most common shellfish allergen. Being allergic to one does not always mean that you must avoid both, though care is needed to prevent cross-contact between fish and shellfish. Symptoms of an allergic reaction. Anaphylaxis is a life-threatening allergic reaction. Not all allergic reactions are anaphylactic. Symptoms of food allergies typically appear from within a few minutes to 2 hours after a person has ingested the food to which they are allergic to. Anaphylaxis can cause tightening of the airways, swelling of the throat, low blood pressure. Symptoms of a severe allergic reaction can include hives, flushed skin or rash, swelling of the lips, tongue, and throat, tingling or itchy feeling in the mouth, shortness of breath, trouble breathing, coughing or wheezing, dizziness, lightheadedness, vomiting, and diarrhea. How to treat an allergic reaction. There is currently no cure for food allergies. Avoiding the allergen is the most important way to prevent a reaction. Those with food allergies should carefully read food labels and always ask about ingredients before eating the food. Epinephrine is the first line of treatment for anaphylaxis. Those with food allergies should always have an epinephrine auto-injector on hand, also known as an EpiPen. If a person is having an anaphylactic reaction, they should use an EpiPen and call 911 to continue medical professional care. Procedure B14. Procedure B14. Purpose. The purpose of these guidelines is to provide suggestions to school administrators on accommodating students with food allergies, which is implemented at a district level. The procedure can be found on the following webpage: nutrition.dateschools.net, under the Policies and Procedures tab. Diet prescription form. District level guidelines at elementary and secondary schools. Responsibility. The food service manager or satellite assistant must be made aware by school administration of any student that has a food allergy, the severity of that food allergy, symptoms of an allergic reaction, and how that child should be treated for an allergic reaction. If the food service manager or satellite assistant is informed by a parent that their child has food allergies, the food service manager or satellite assistant should make sure that the parent has informed The school administration. The school administration is responsible for the collection and processing of the applicable district required documentation regarding emergency orders and authorization for rescue medication depending on the severity of a potential food reaction. If a child with a documented food allergy per school administration is going to be buying lunch from the school cafeteria, the child must have a diet prescription for meals at school form completed and signed by a licensed physician. This form can be found at dateschools.net. Head Start and Early Head Start programs. What is Head Start? It's a federally funded program that offers free comprehensive services to children from birth to age 5. Located across 34 schools within Miami-Dade County Public Schools. Nutrition services. It provides special menus to students with any food allergies and intolerances and/or food preferences due to personal or religious reasons. Head Start and Early Head Start procedures. The nutrition coordinator must be informed that a child has a food allergy by a Head Start staff member. Parents are asked to provide documentation completed and signed by a licensed physician. Documentation is kept in the student file. The nutrition coordinator provides a special menu to accommodate the student needs. A copy of the special menu is kept in the student file, and a copy of the special menu is provided to the parent, teacher, and food service manager. Required documents. Diet prescription form, FM 5425, which is found in dateschools.net. Additional documentation required. Authorization for medication and severe allergy action plan forms, which are found in dateschools.net. Head Start Special Menu Sample. In this case is a lactose intolerant menu. The foods highlighted in yellow are substitutions for foods the student can consume. The special menu consists and is based on a 4-week menu cycle. This is an Early Head Start special menu sample. Our school's kitchens. Cafeteria staff must be informed and aware if a student has a food allergy. A note is documented in the system, providing an alert in the cashier once the student with a food allergy enters their ID number. During meal preparation, staff follows proper sanitation practices by hand washing before, during, and after changing tasks, using clean kitchen utensils, avoiding cross-contamination, and following the district's schools menu. Smartphone apps. Shopwell app. Apps are some useful tools that provide some type of guidance and aid in a specific matter, in this case with food allergies. It's available both in the App Store and in Google Play. The free Shopwell app simplifies nutrition labels regarding food allergies. Simply scan any item to see quick nutritional information. Discover products that are a better match for you. This comes very handy when going grocery shopping. Allergy Eats app. Allergy Eats free app is a guide to find allergy-friendly restaurants in the U.S. Customize your search results for major allergens and dietary restrictions. Access the menus of over 400,000 restaurants as well as the allergy menus for some as well. Let's review some concepts. Food allergy versus food intolerance. A food allergy causes an immune system reaction. Food intolerance symptoms are generally limited to digestive problems. What is a food allergy? Occurs when the body's immune system sees a certain food as harmful and reacts by causing symptoms. 8 common allergens: milk, egg, peanut, tree nuts, wheat, soy, fish, and shellfish. How to treat an allergic reaction. If an anaphylaxis reaction appears, use an EpiPen and call 911. Procedure B14. The purpose of these guidelines is to provide suggestions to school administrators on accommodating students with food allergies, which is implemented at a district level. Smartphone apps. The Shopwell app simplifies nutrition labels regarding food allergies. Allergy Eats app is a guide to find allergy-friendly restaurants in the U.S. Sources used for the creation of this webinar. Sources continued. Thank you for your time and attending this webinar.